As we grow older, our health becomes a top priority. Regular checkups and screenings are important for early detection and prevention of many diseases. However, not all medical tests are beneficial for everyone, especially as we age. Some tests that were once useful might no longer be necessary or safe. In fact, they can sometimes lead to more harm than good. In this article, we will talk about 5 common medical tests that people over 70 may want to avoid. We'll explain why they might not be helpful and, in some cases, how they can even cause problems. Of course, every person is different, so it's important to talk with your doctor before making any decisions. Let's take a closer look at the 5 medical tests older adults should reconsider. Colon cancer screening, colonoscopy. Colonoscopy is a test that checks the colon for cancer or other problems. It can help find and remove polyps before they turn into cancer. This test is usually recommended for people between ages 50 and 75. But after 70, especially past 75, the risks can start to outweigh the benefits. Why it may be harmful. Colonoscopy is an invasive test. It requires sedation and special preparation, which can be hard on older adults. There is a small risk of complications such as bleeding or a tear in the colon. If a person has other health problems or a shorter life expectancy, they may not benefit from finding a slow-growing cancer that might never cause issues in their lifetime. What to do instead? Talk with your doctor about your overall health and whether continued screening makes sense for you. Less invasive tests, like stool-based screening, may be safer if screening is still needed. Prostate cancer screening, PSA test. The PSA test measures a protein in the blood that may be a sign of prostate cancer. While it can find cancer early, it can also lead to overdiagnosis. Why it may be harmful. Many prostate cancers grow slowly and do not cause symptoms. The test may lead to biopsies or treatments that are not needed. Treatments for prostate cancer, such as surgery or radiation, can cause serious side effects like incontinence or erectile dysfunction. What to do instead? If you're over 70 and have no symptoms, you may not need this test anymore. Discuss your personal risks and benefits with your doctor. Breast cancer screening mammogram. Mammograms are used to detect breast cancer early. While they are important for women between 50 and 74, continuing them after 70 depends on a woman's health and personal risk. Why it may be harmful. Mammograms can lead to false positives, which may cause worry and lead to more tests or biopsies. Some detected cancers may never grow or become life-threatening. The benefits decrease if a woman is in poor health or has a limited life expectancy. What to do instead? Talk with your doctor about your health, and if continued screening is right for you. If you are in good health and have many years ahead, screening may still be helpful. Cervical cancer screening, Pap smear. Pap smears check for changes in the cervix that could lead to cancer. This test is generally recommended for women under 65. Why it may be harmful. After 65, if a woman has had regular normal results, she usually doesn't need more Pap smears. The test can cause unnecessary stress, discomfort, and follow-up procedures. What to do instead? If you've had regular normal tests, ask your doctor if you can stop. You may still need pelvic exams for other reasons, but not necessarily Pap tests. Bone density test, DEXA scan. Bone density tests check for osteoporosis, which is a thinning of bones that makes them more likely to break. While this test is helpful for women over 65 and men over 70, repeated testing may not always be necessary. why it may be harmful. Some older adults are tested too often, even when there has been no change in their condition. Repeated testing may lead to unnecessary treatment or worry. Medication for bone loss can have side effects and may not always be needed. What to do instead? If you've already had a bone density test and are being treated, you may not need frequent repeat tests. Talk with your doctor about how often you really need this test based on your health. Understanding the bigger picture. As we age, our health needs change. What was once helpful might no longer be necessary. Doctors are starting to look more closely at the risks and benefits of screening tests for older adults. In many cases, the focus shifts from detecting disease early to improving quality of life. Overdiagnosis is a growing concern. This means finding a problem that would never have caused harm. Overdiagnosis can lead to unnecessary treatment, stress, and side effects. It can also shift attention away from more pressing health issues. Questions to ask your doctor before going through with any medical test. It's wise to ask your doctor questions like, what are the risks and benefits of this test at my age? How will the results affect my care? Do I really need this test if I don't have symptoms? What happens if we don't do the test? Your doctor can help you decide what makes the most sense based on your health, lifestyle, and preferences. The role of personalized care. There is no one-size-fits-all answer when it comes to medical tests. Each person is different. A healthy 72-year-old who exercises daily and has no chronic conditions may benefit from some screenings, while someone else the same age with multiple health problems may not. Doctors now use a more personalized approach to health care. This means looking at your complete health picture, not just your age. Factors like your activity level, personal history, family history, and life expectancy are taken into account. Lifestyle and prevention still matter. Even if you choose to skip some tests, staying healthy is still very important. Here are a few tips for healthy aging. Eat a balanced diet rich in fruits, vegetables, whole grains, and lean protein. Stay physically active with walking, stretching, or other gentle exercises. Keep your brain active by reading, learning new things, or playing games. Stay connected with friends and family to avoid loneliness. Get enough sleep and manage stress. Take your medications as directed and attend regular checkups. The importance of communication with health providers. As people grow older, open and honest conversations with doctors become even more important. Sometimes, older adults go through tests or treatments just because they always have, not because they still need them. Other times, doctors may suggest a test out of habit, not realizing it may no longer be necessary for someone of a certain age. That is why it's important to be an active part of your own health care. Don't be afraid to ask questions or voice your concerns. A good doctor will listen, consider your values, and help you weigh the pros and cons of any medical decision. Some helpful things to bring up during your next visit. How does this test help me at my age? Are there safer or simpler alternatives? Will the result of this test change the way we treat anything? It's also a good idea to bring a family member or caregiver with you if you feel unsure or want extra support in understanding your options. Avoiding unnecessary treatments. Tests often lead to treatments, and that's where things can get complicated. Sometimes treating a condition found during a screening doesn't actually help a person live longer or better. In fact, it may do the opposite by causing new health problems or side effects. This can happen with treatments for certain cancers. For example, a slow-growing cancer that never would have caused harm might be aggressively treated, causing pain or complications that reduce a person's quality of life. By skipping unnecessary tests, you may also be avoiding unnecessary treatments, hospital visits, stress, and expenses. That's why careful decision-making is so important as you get older. Mental and emotional well-being. Health is not only about physical tests and treatments. Mental and emotional well-being play a huge role in living well after 70. Anxiety about health, constant doctor visits, and worry about test results can take a toll on your mental health. By avoiding unneeded medical tests, you may reduce that stress and free up more time and energy to enjoy your life. Instead of focusing on medical concerns that may never affect you, you can spend time doing things you love, being with the people who matter to you, and staying active in your community. Focus on what matters most. As you age, it's helpful to shift your focus from just living longer to living better. That means asking, what brings me joy and what keeps me feeling good each day? Health care should support those goals, not get in the way of them. Sometimes skipping a test and saying no to a treatment is the best way to take care of yourself. It means trusting your body, understanding your priorities, and making choices that support the kind of life you want to live. Talk with your doctor regularly, stay informed, and always listen to your own instincts. You are the expert in your life, and your voice matters in every health decision you make. Next, we will look at some real-life stories of older adults who chose to stop certain tests and how that decision improved their lives. Real-life experiences, choosing a wiser path. Margaret's story, saying no to mammograms. Margaret is 78 years old and has always taken her health seriously. She had regular mammograms from her 50s through her 70s, but in recent years, she began to feel uneasy about the stress and discomfort the exams brought her. After talking with her doctor, she learned that continuing mammograms past a certain age may not benefit her, especially since she had no history of breast cancer and had consistently normal results. Margaret and her doctor agreed it was time to stop. Instead, they focused on regular physical exams and watching for any unusual changes. She felt relieved, less anxious, and more in control of her health decisions. Robert's journey, understanding PSA testing risks. Robert, a 74-year-old retired teacher, had been getting PSA tests for years. When his latest results came back slightly high, his doctor suggested a biopsy. Concerned, Robert did some research and learned that prostate cancer often grows slowly. He was in good health, but also valued his quality of life. He talked with a urologist who explained that aggressive treatment might not be needed at his age. Together, they chose active surveillance instead of immediate treatment. Robert continues to monitor his condition, but avoids the side effects that come with surgery or radiation. He says, I feel like I made a smart, informed choice. Linda's decision, letting go of colonoscopies. Linda is 80 and has had several colonoscopies in her lifetime. Each one had been clear, but the preparation and recovery were becoming harder on her body. After a conversation with her new geriatrician, she discovered that further screening wasn't likely to benefit her at this stage. She stopped doing colonoscopies and instead follows a healthier diet, takes supplements, and watches for signs of digestive trouble. Linda appreciates not having to go through the difficult prep and anesthesia. Her focus now is on staying mobile and enjoying time with her grandchildren, Thomas and the Pap smear paws. At 73, Thomas's wife, Elaine, was surprised when her gynecologist told her she no longer needed pap smears. Elaine had always kept up with screenings, but she hadn't realized that guidelines change with age. After reviewing her history, the doctor explained that continuing the test could do more harm than good. Elaine now goes in for routine pelvic exams when needed, but no longer has pap tests. She feels more comfortable knowing that she isn't undergoing unnecessary procedures and can still take care of her health in a practical, age-appropriate way. Richard's view on bone scans. Richard is 76 and had a bone density test at age 70. It showed mild bone loss, and he began a low-dose treatment. For years, his doctor kept recommending repeat scans, but Richard didn't feel different, and the results always came back the same. After seeking a second opinion, he learned that bone scans don't need to be repeated every year if there's no change in condition. Richard decided to stick with his current lifestyle and treatment, but stopped the yearly scans. He now focuses on exercise and a calcium-rich diet. Lessons from these stories. What these real-life examples show is that medical care after 70 doesn't have to follow the same rules as before. Older adults are learning to ask better questions, consider their personal values, and work with doctors who respect their choices. Each of these individuals made different decisions based on their own health needs and comfort levels. None of them ignored their health. Instead, they learned how to manage it more wisely. They prioritized quality of life, mental well-being, and independence. These stories are a reminder that it's okay to step back and think twice about routine tests. Being proactive doesn't always mean doing more. Sometimes it means doing less, but doing it with purpose. The bottom line, as we continue to live longer, it's important to make smart choices about our health. Not every test will help us live longer, and some may even bring unnecessary stress or harm. The key is to stay informed, speak up, and work closely with your healthcare team to make decisions that reflect your values and goals. You deserve care that is not just based on your age, but on your life as a whole. Whether it's saying no to a test, asking for more information, or choosing a new care plan, your voice matters. Always remember, good health isn't just about preventing illness. It's about living your best life every single day. Final thought. Aging is a journey that brings with it wisdom, perspective, and a deeper understanding of what truly matters. Clarity and quality of life. Older adults deserve care that respects their experiences, honors their choices, and promotes well-being without unnecessary burdens. By rethinking the value of certain medical tests after 70, individuals can reclaim a sense of control and reduce anxiety about their health. This doesn't mean ignoring symptoms or avoiding care. It means being thoughtful, informed, and intentional about the kind of care that truly supports your goals. The decision to skip or continue a test should never be made out of fear or pressure. Instead, it should come from open conversations with doctors, careful reflection on your personal health journey, and an understanding that more tests don't always mean better care. In the end, aging well is not about chasing every possible diagnosis. It's about enjoying your time, maintaining your dignity, and choosing a path that aligns with your values. Trust yourself, stay informed, and remember, your health decisions are yours to make, with guidance, compassion, and respect.